I'm going to kick us off. Good afternoon. Thank you everyone for joining. My name's Anya Kemble. I'm a senior consultant at Mutual Ventures and I'll be chairing today's conversation. And what we're going to be talking about today is the government's commitment to establish a network of Young Futures hubs across England as part of the Young Futures programme, which is aiming to support young people's mental health and reduce vulnerability to knife crime. But really, we're also going to talk about what could that actually mean in practice and how can we learn from programmes of supporting young people across local government and also the voluntary sector. I'm very excited to be joined by a great group of panelists who have got decades of experience providing support directly to young people. And we're going to hear from them today about what lessons they've learned and they think should be considered as a programme of Young Futures hubs is set up. During the webinar, we're going to hear directly from our panelists about the support that they currently provide to young people, how they think Young Futures hubs should be designed, and how Young Futures hubs should fit into the wider system of support for young people and their families. Before I introduce our panelists, let's reflect a bit on what we know so far about Young Futures hubs and the Young Futures programme. So whilst Young Futures hubs is a new term, the concept of youth hubs is not a new concept. There is a network of youth hubs and support in existence across the UK, and previous programmes such as violence reduction units, family hubs and Sure Starts have all recognised the need for support to be accessible in the community for vulnerable young people and their families. In 2024-25, 4.9 million was invested in early support hubs for children and young people's mental health and wellbeing. And that pilot explored innovative models of mental health and wellbeing support for children aged 11 to 25. It funded and evaluated 10 existing early support hubs that provide support to young people and deliver wider benefits such as improving engagement with education, employment and training. And then this year, the government has provided more detail about Young Futures hubs and the funding available. Actually, this announcement was, I think, in the past couple of weeks. So backed by a £2 million cash investment, the government is committed to 8 hubs launching this year, targeted in areas with high levels of knife crime and antisocial behaviour and offering a lifeline to vulnerable young people. The government has also said that they expect to have 50 Young Futures hubs launched over the next 4 years. And they've been clear that Young Futures hubs need to be multidisciplinary, providing support, including youth workers, mental health support workers and careers advisors to support young people's mental health and avoid them being drawn into crime. So with that context set, what should the government be thinking about as they develop their policy around Young Futures hubs, and what can they learn from programmes of support that are already out there? Our panellists today bring a critical insight into delivering support to and with young people. So what I'm going to do before we get into our kind of Q&A discussion is come to each of our panellists, both to hear a bit more about what they do day to day, but also reflections from programmes and projects and organisations they work within that they kind of want to share and reflect before we get into our discussion. So first member of our panel is Steve Bywater, who is a programme manager within Children's Services in the Royal Borough of Kensington and Chelsea and Westminster City Council. And Steve has got some slides that he wants to kind of run us through just to introduce himself and the work that he's been doing across those local authorities. So I'll hand to you, Steve.
Thank you, Anya. Yeah. So just a bit about my background. In recent years, I've been managing the Supporting Families programme in Westminster and also Kensington and Chelsea, where we have a bi-borough arrangement. And that programme led me to get involved in the family hubs provision that we started to develop in both boroughs around 2018, 2019. And then as time went on, some opportunities arose and some developments locally through which we developed some youth hubs in the borough. And it felt like what we have been developing had quite a lot of synergy with the Young Futures hubs that are now being talked about. So I was just going to walk you through what we currently have, particularly in Westminster, and how they came about and the kind of ingredients that they include. So we currently have 5 youth hubs across the borough. It's a really small borough. It's 8 square miles. You probably know it. It's got quite a reputation, I suppose, in terms of where it is in the country. But the high levels of need that we see in the borough in the north and in the south, and that's where our youth hubs are currently located. The intention was that they were going to be sort of leaders of a range of organisations within their localities. There are a lot of small providers of different types of youth provision in Westminster, but previously those hadn't been particularly networked. And in 2019, we didn't really have any significantly funded youth clubs of any description. There were small groups that were having to fund themselves. So there was just an opportunity to pull some of that expertise, knowledge, and resource together to form some youth hubs in the borough. We already had a family hub system up and running at that time in its infancy, I suppose, and we were really keen to link the new hubs for young people into those broader family umbrellas that we had 3 locations for in the borough. Some of the work that took place in the youth hubs was commissioned by Children's Services, and what we really wanted the youth hubs to focus on were things like healthy and safe lifestyles for young people. We were concerned about serious youth violence at that time, so we saw that as an opportunity to focus some of that activity. To better understand the range of activity in that area, so to sort of share information about what was going on for young people in terms of provision and so on, and also to link together the practitioners that were working in those areas. We were interested in transitions to adulthood and also getting young people into employment, education and training where that was needed. And also to provide a whole range of opportunities for young people to lead them towards the outcomes that they wanted to achieve. The next slide, please. So the offer through the grant agreement that the hubs have had with Westminster is open access youth provision, 2 different age ranges focused on from 8 up to 19, provision across 5 days a week, and a whole range of activities as well that will be run from those locations. Important that they work with the resident population. Westminster's got a very mobile population, lots of people coming in and out on a daily, but also longer term basis. And important that they could also respond to some of the issues that we had with newly arrived populations who were placed in hotels with children and young people needing access to support very quickly. So they took a key part in that. Outreach was important to us as well. So although we got the locations, important that we linked into other areas where children go, schools in particular. And we developed something called Our City, which is a website which contains pretty much everything that's going on for young people in Westminster and also in Kensington and Chelsea. So making sure that offer was properly promoted to as many people as possible. And as said before, we wanted them to participate in the family hub structures. Next slide. So in terms of the family hubs, we see the family hubs as being kind of the main kind of exponents of our early help system across the borough. A key part of our family hubs is the integration of services to get them to work together as much as possible to one operating model. And although we have 3 buildings where the family hubs are located, the way of working was more important to us in terms of different practitioners from different agencies sharing information and working in a collaborative way with children and families in the area. And also importantly, that we're providing help as early as possible. The youth hubs, as soon as they were set up, we started to involve them in the family hubs through what we're calling integrated leadership teams, which are groups of managers working across the 3 localities. And it was really important to get the youth managers involved in those so they could share information about what they were experiencing in terms of local needs, how they were responding to that, and also sharing information and a 2-way process between the professionals working with children of other age groups, their families, and agencies working with older children. The youth hub buildings were another opportunity for families to access services. We found that older children weren't really wanting to go to the family hubs that were set up, which in many cases were kind of an extension of what we had under the children's centre system. But they were choosing to use the youth provision. So an opportunity if we work together to identify children, families who needed wider support in a different way. The youth workers that are linked to the hubs would attend the family hub panel meetings so they can take cases that they're concerned about and get a multi-agency perspective on who can support with what and other views, I suppose, on how families might be engaged where there are difficulties. And something we noticed during lockdown was that youth hubs were increasingly getting into contact with parents and other partner agencies who were contacting them about children that they were concerned about during that period. So that sort of parent angle improved and grew during that period. And through that, they were able to connect some of those parents with the early help structures and do the preventative work with whole families where that was appropriate. Next slide, please. Youth voice was a very important part of all of the developments we did around youth hubs. So we really wanted to be able to capture the views and experience of young people to help develop the services that are available. And also, we felt that the youth hub should play a key role in encouraging other partners to capture that voice and share that information. We're very conscious with a very broad range of different agencies working with children and families. That information is going to be captured differently in different places. So important to put it together and try to make sense of what people are saying and what they need. This commitment's included in the various strategic plans we had, and in the current plan, which is going to be developed, we're continuing to think about the voice of children and young people and what youth hubs are telling us about that. Very importantly, the youth hubs participate in the Young Westminster Foundation's needs analysis, which takes place every 3 years. I've got my colleague Helen, who's the Chief Executive for Young Westminster Foundation, who can say more about that. But that is a major exercise to try and ascertain what young people are thinking about the experience of living in Westminster at a point in time, what their needs are, what we're doing well, and what we need to do differently. And the youth hubs are very much hubs for that activity going forward. Each youth hub's got its own engagement methods and allowed some sort of self or independence in terms of how they run their services, but we capture that and build it into service level agreements which they've got with the council. And also, we should say that Young Westminster Foundation provide additional support around this to the youth hubs, building on the broader experience they've got of working with different partners in the sector. And just finally, a couple of areas of service, I suppose, that are quite heavily linked to the what's been said so far about Young Futures hubs. So in terms of the emotional wellbeing and mental health offer for young people, it's something that young people have continuously said that they want more support with and different types of support. And again, during the pandemic, that became even more pronounced. So we do have a range of different services at the moment, some of which are specifically linked to the youth hubs, where we've got mental health workers who go into those settings on a regular basis. Some services that are commissioned, or we have other agreements with, such as All Child, who work in a range of schools across the borough, providing one-to-one support, and specialist services for other groups of children. Alongside of that, we've got some health commission services, Couth, which is an online system of getting support for young people. A very strong network of mental health support teams working in all of the schools in the borough with workers who can do direct work with children as they need it, and then work with them to get them into other services as required. And then you can see them listed, a whole range of other different opportunities. And the key, I suppose, is making sure that these services work together, and their links into youth hubs are really important when there are children of that age who need support, which is coordinated. And very importantly as well, the whole thing about relationships, who's got the best relationship with the young people concerned, so we can hear what they need and they can help those young people to get the support that might best meet their needs. And the last slide, please. So just in terms of serious youth violence, we've had a service called the IGXU in place for getting on for 15 years now, which is a multi-agency group that works with young people aged 10 to 25 who are at risk of exploitation or vulnerable to violence or gang-related activity. It's very much multi-agency, includes representatives from a range of different council services, plus agencies such as Job Centre Plus, the police, and does a lot of joint work with housing and the health and the voluntary and community sector. Importantly, it works with all of the youth hubs and clubs in the borough, secondary schools and colleges. There's a lot of outreach community work with a very specialist group of workers doing weekly work with gangs or people who might be involved with gangs across the borough. They have 80 to 90 live cases at any one time and will be going into settings at the drop of a hat if necessary where incidents have occurred or where there are concerns, such as hospitals and police stations. And the overall aim is to improve lifestyle choices, I suppose, and reduce serious youth violence through doing things like one-to-one work, planning safety with young people, work around sexual health, thinking about their access to education, training, employment, and doing group work and diversionary activity, along with working with other agencies who are concerned about particular children and young people. So that's our sort of offer in Westminster at the moment. As I've said, Young Westminster Foundation are quite key to that, and I think my colleague Helen's going to be introduced in a moment to say a bit more about their role in this offer.
Thank you very much, Steve. And yeah, I'm going to come to Helen next because I think it'll follow on nicely from some of the context that you've just set. Before I do, just to say there's a question in the chat about whether the slides can be shared. We'll share a recording of this after, and I'm sure we can share the slides as well. So just to say that up front. Now I'm going to come to our next panelist. Steve's kind of already introduced her for me. So that's Helen Mann, who's the Chief Executive of the Young Westminster Foundation that Steve mentioned a few times there. So over to you, Helen.
Great, thank you very much, Anya, and thank you, Steve, for the introduction. I suppose the first thing to say about Young Westminster Foundation, and certainly in the context to Westminster, is that we are completely independent. So we are an independent charity, and I think a lot of our success in working together with the council really comes from the fact that we are completely separate, and often we'll look at things in a different light. I suppose that just a little bit of background about the Young Westminster Foundation itself. As the name probably suggests, we're based in Westminster, and really our remit is to serve children and young people living or at school in Westminster, but we do that not really directly, but we do that through our membership organisations. Our members are all charities or not-for-profits working with children and young people aged up to 25. And I suppose the primary purpose of Young People's Foundations, of which we are one of the earliest ones, is to support and build capacity in the children and young people's sector within the different areas that we are working. And so we are part of the Young People's Foundation network, which is a network which was set up 10 years ago by John Lyon's charity in Northwest London, as a response really in cuts to funding for children's services. And this model was initially developed for the 8 Northwest London beneficiary areas, but it's been picked up across the country now through the work of the YPF Trust, leading on the work of local partnerships. And so we've been around since 2017. What I would say is that all of the Young People's Foundations look a little bit different, and that is because the strategy is very much based on the needs of each area. But I think we all have 4 key strands in our work, which are really facilitating fundraising, distributing grants, capacity building and supporting qualifications and providing training. And I suppose very importantly, advocacy. So both for youth work itself, but really for the voices of young people in the borough, and our work with local government, central government and MPs really brings that advocacy and the voices of young people to the front. As I said earlier, well, Steve mentioned our needs analysis. So when we first set up, in order to really decide what we were going to do first, we conducted a piece of peer-led needs analysis. And we have repeated that every 3 years. So we train about 15 children and young people in asking questions which they help devise, and then they go out and ask about 250 of their peers what they like about living in the borough, what they don't like, what's going well for them, what isn't going so well. What we hear back from that not only shapes our own strategy, but increasingly commissioners and other funders in the borough and more widely are looking at that to really help them design their services and to think about what really should be key in what is being commissioned locally. I think the final thing to say is that we are independent, but also the youth hubs are independent. So the 5 main youth hubs that we have in the borough were created really at a time when the funding had been cut from the council. Some of that has now been put back in. But the independence of those youth hubs and the fact that even now the funding that they're receiving from the council is only a percentage of their funding, and their independence in how they work, who they work with, and how they fund themselves, I think is really key in the way that they are able to develop and act and morph really as they need to be in line with what children and young people need. And finally, just to say that I work really closely with Westminster City Council. We work with other stakeholders, including the NHS, the police, the BRU, really acting as that kind of that segue to bring people together. And I think that means that we have been able to ensure that the hubs have a full range of services there. So if there isn't funding that can come from the council for a certain thing, we can either signpost to a service that we know, or we might be able to supplement that service by some of the funding that we've been able to bring in from maybe a trust and foundation or maybe a local business. And so that diversity of funding streams, but also in practitioners who are working in the hubs, and a very close working relationship with lots of different commissioners within the council, I think has really meant that the services that children and young people are able to access in the youth hubs is much wider. Yeah, thank you, Anya.
Thank you very much, Helen. And I think lots of interesting points there, including the stuff that you talked about around advocacy, young people's voice. I think it'll be interesting to touch on some of that when we get into our discussion, as well as the independence and ability to create hubs in hyperlocal areas that serve the needs of the young people there. So looking forward to getting to that in the discussion. I'm going to introduce our next panelist now. So that is Steve Kay, who's a director within Birmingham City Council.
Hiya, so I'm Steve. I'm Director of Schools and Employability with Birmingham City Council. Within my portfolio, it does what it says on the tin really. So obviously schools and all that comes with that, multiple services, employability in terms of post-16, but also within my remit, youth services and careers guidance. I'm a teacher by trade, but I'm also a professional youth and community worker as well. I've been in public service for nearly 30 years, and so I've been responsible for all of the different versions of what we're talking about today. So Sure Start, for a number of years, I led a number of Sure Start centres as part of my director of prevention portfolio. I then became family hubs in different authorities, youth clubs, one-stop shops. I used to be a director of connections when that existed. So all of this is familiar territory to me. I think what's interesting about it, lots of things that are interesting about it, but first of all, the fact that youth work and careers guidance has been recognised as something of interest is music to my ears, because those services over the last 15 years have been gradually decimated in many authorities, which has been a real national tragedy and has been a contributory factor to some of the challenges that young people face across the country, and certainly mental health. Speaking to young people as I do often, and see their what they're saying in different authorities in which I've worked and different areas, that mental health comes up consistently. Certainly in all of the schools that I visit regularly, I visit schools more than most, and mental health is certainly a factor. Birmingham is huge. It's got more canals than Venice. It's 10 districts, maybe It's like 10 different cities, really. So we've got a little bit of everything. It's a global majority city, which is something we're really proud of. And we have lots of reasons to be cheerful, but we also have lots of challenges. And the issues for young people in each of those 10 districts could be completely different. And, you know, what's right for Runcorn or Liverpool or Westminster or Rochdale might not be right for the kids in inner city Birmingham or even different parts of Birmingham. So I think it was Helen's point about youth voice. That's really, really crucial as part of this, because what needs to happen is it can't be a prescription, particularly with the money and the resourcing being rolled back from the original ambition. It cannot be a prescription to say you must have one of these, you must have one of these, you must have one of these, because that simply won't work. It's got to be about young people's needs. It's got to be hyper-local. And also some young people, perhaps young people with SEND, are perhaps disproportionately represented in those who are vulnerable to CCE. Or, but actually it could be any young person in any area of any ethnic or socio-economic background. It could be any young person. So for me, what's really, really important is that it's not just about these hubs. It's got to be about what's happening in that area, that district, that town, that city. And it does, I don't know why I'm on about resourcing, but it does need investment. It absolutely does need investment, and there's no shortcut to that. And it's not a case of, you know, local government and voluntary and community sector colleagues are the masters of resource weaving. We make do and mend all of the time to try to get the best possible outcomes and the best possible deal for young people as we do. But it's there's no getting around the fact that this needs resource, and it needs real, genuine resource. Sure Start was a success. One of the reasons it was a success was because it was child and family focused, and it had adequate investment. All of the evidence points to the fact that prevention focus works, and so this is something that can't be done on the cheap. I won't go on about that, but I just need to make that point. So in terms of Birmingham, so we hit the press for all sorts of different reasons all of the time, and often much of it is not accurate. So in terms of youth services, for example, I think we hit many of the headlines in relation to us slashing youth services. We didn't. That wasn't our plan. We've actually invested and grown our youth services by our youth service by 25%, but it's still it still needs further investment nationally, certainly for us in the city. We've just redesigned it. I was part of leading that work, and we spoke to young people, nearly 2,000 young people actually, in terms of what it meant to them. What does it mean to be safe in Birmingham? What does it mean to be healthy? You know, what does it feel like to be a young person in Birmingham, and what does that mean? And so that led us to change our delivery model. So we've invested further in voice and influence work, because ultimately young people need to be involved in the design, delivery and evaluation of services. We've also invested in terms of special educational needs and disabilities, and also alternative provision, where young people are often more vulnerable within those areas, and actually the voice and influence thread is something that's really consistently important to us. We're developing a district model with our partners in Birmingham Children's Trust and interagency partners. There's a lot of work going on, and the foundations are being built for that. What's really, really important about that is that each district in Birmingham might as well be another city, because the needs of the communities, the needs of young people are often very, very different. And so what we need is a consistency of approach in terms of the fact that it would be youth and community informed, it would be evidence-based, we'll understand lived experience, we'll have a prevention focus, and we always seek the collaborative advantage. But outside of that, we need to be flexible to young people's needs. I'll shut up now, but yeah, lots to say.
Well, hopefully you won't, because we've got a whole webinar to do, Steve, but
Yeah,
thank you very much.
well, I must also say, just really quickly, I'm also, if this is a bit of a plug, but I'm also one of the founding trustees of the Independent Federation for Safeguarding, which is a new charity, free to join for colleagues who are interested.
Thank you very much. And just there was a question in the chat while you were starting to talk, Steve, which I think I'll just come to now before I introduce our final panelist, which was asking whether is there a difference between youth hubs and youth centres, and is this a recognition that youth work has a key role in supporting young people outside of just statutory services? And I think that talks to a lot of what you were just saying. I think there's still lots of questions about how central government will kind of want this programme to be implemented across England, but the key thing is that supporting young people is not something new. Everybody on this call has been doing it, whether it's been something that's come up in kind of central government manifestos, etc. It's good to see that refocus, I suppose, from the government on the Young Futures Hubs and programme. But I think the key thing is that this isn't new. This is the kind of bread and butter of lots of you have been doing.
It's not new, and I suppose it depends in terms of the question. It's how you define it. A youth hub is not. It can never be the panacea, and youth centres don't exist, sadly, in some areas. And what we need is, we know we've got an emerging national youth strategy. We're developing a youth strategy in Birmingham, but we need a strategy for youth work. We need a strategy for careers guidance. We need to be working with the National Youth Agency in terms of the development of that and what that means and how that translates in a both for the voluntary community sector and also for children's services and health services in all of their forms. So I think depending on how you define it, there could be a difference, but it's an interesting observation, because actually, what is the difference between a youth centre and a youth hub? And where we're fortunate to have youth centres or youth access points, or whichever you want to call them. What are we doing in terms of investing in those? What are we doing in terms of ensuring that the infrastructure that does exist within a community, what are we doing to ensure that that's connected? Because certainly when we did the youth review in Birmingham, we pulled together, we're looking at it through that local authority lens, and actually there's a rich tapestry of a voluntary and community sector activity that exists across the city that we need to be more purposeful about and ensure that we support, and ensure that actually that I mentioned resource weaving, that we actually think about ourselves as, because we're all public servants regardless of what our badge says, so we've got a professional and moral responsibility to connect wherever possible. And these ideas are not new. It's what we all try to do every day, but this new investment is welcome. There needs to be more of it, and we need to make do the best we can with it, I think.
Thank you, Steve. And now we'll come to our final panelist ahead of the kind of Q&A starting. So Charlotte Rayner is the Coalition Manager for Children and Young People's Mental Health Coalition.
Hi everyone, thank you, Anya. So hi everyone, as Anya said, my name's Charlotte Rayner. I manage something called the Children and Young People's Mental Health Coalition. We bring together over 400 organisations from across the country to campaign jointly on children and young people's mental health. So whilst we ourselves don't provide direct support to children and young people, we do policy and lobbying work to try and improve those systems of support for children and young people. And we really try and be that representative and reflective voice of the children's mental health sector. We work across 3 strategic areas, which are focused on prevention, early intervention, and strengthening specialist services. And we have been calling for the hub model for children's mental health. We've for quite a few years now, we've been big supporters of it. We've been part of a national campaign called Fund the Hubs with other charities from across the sector, which has been going for about 5 years now. And that's been calling for a national network of early support hubs in every local area. So early support hubs being these open access drop-in spaces in the community where young people can turn up without an appointment, they can self-refer to get some support with their mental health. Typically, these hubs have mental health workers, they have youth workers, they also provide a holistic offer of support around employment, housing, sexual health, so they can be kind of that real one-stop shop for young people. We have been making some progress with government on these hubs over the past few years, and as Anya mentioned in her introduction, a couple of years ago, the government invested in a pilot of early support hubs. They gave some funding for 24 hubs to kind of expand their offer of support. We were really strongly lobbying parties ahead of the general election last year to make a commitment to these hubs. So we were really pleased to see that Labour in their party manifesto committed to Young Futures hubs, as Anya said, which would be providing mental health support alongside careers advice and violent crime reduction support as well. I think what's been really key for us is, as all of the panelists have spoken about and as we've kind of seen, these hubs aren't new. The early support hubs we've been calling for, there's been so many, there's about 60 we estimate across the country that have been providing this support to young people in local communities for so many years now. So what we've really been trying to do ever since the Young Futures Hub commitment is really making sure that the government stay true to their aims, that these provide mental health drop-in support for young people. I think quite a few of us from across the sector are worried about the crime prevention narrative that is kind of emerging around these hubs and how that could potentially be stigmatizing to young people before they kind of even walk through the door. But also that they don't reinvent the wheel and that they really kind of build on this existing provision that already exists in local communities. And I think what's key for us is these really need to be community driven and kind of supporting young people where they are. And we published a blueprint earlier this year as part of the Fund the Hubs campaign, which really kind of laid out a way forward as to how we think the government should roll out Young Futures hubs. And for us, that is really just about building on the existing provision, giving the services that already exist the funding that they need so that they can be sustainable, but also working within local communities to kind of bring services together to set up new hubs where they aren't any. And underlying all of that is the voices of children and young people. I think that's it from my introduction. Anya, I'll hand back over to you.
Thank you very much, Charlotte. And actually, the final point you just made, I wanted to come to, I suppose, as my first question as we get into the discussion today, which is, I think in each of the individual presentations from you all, you talked about kind of working with young people or advocacy or engaging with young people as part of developing approaches and strategies. I wondered if actually we could just start by reflecting on good methods of engaging young people. How do you make sure you're engaging young people in a meaningful way? It doesn't feel like you're kind of going to them, asking questions, going away, creating something that's totally separate to them, doesn't reflect their needs. And I suppose, how do you continue to engage and work with young people during delivery as well? Because I think we all talk a lot about co-design, co-delivery across the public services, and we all want to do it really well. But I would be, really interested to hear your reflections on how you can kind of do that in a sensitive way. Yeah, I'll come to you first, Steve.
I suppose there's a million ways really in terms of voice and influence. Everyone's a critic, everyone's an expert. It's difficult, but ultimately it's about the relationship with the young person. There are, we have the more traditional models of young people being on a board or a committee, etc., and all of those things, which is often criticised. But I think it doesn't need to be complicated. When we were in Rochdale, we've also done it in when I was in Rochdale previously, and then also in Birmingham. We've done an awful lot of work on understanding lived experience, because we can design a hub or a model or a service, etc., and young people could be involved in it. But unless that actually genuinely makes a difference to the lived experience of children and young people, it's just noise. It's just kind of moving deck chairs, really. So what we did, looking at severe absence as part of a national project with ISOS Research as part of Local Ed 2025, we looked at the initially just 10 young people, and looked at a kind of 360-degree view of their lives and what was going on, but then also really, really crucially spoke to them and their families about their experiences of severe absence. And actually we were systematically getting our approaches wrong, because we were designing services and not designing them with children and families. So actually, the way that I kind of describe that often is kind of operation went well, patient dead. Everyone doing their bit, but actually in terms of the child and young person, they weren't involved in the design, and we weren't as cognizant as we should have been in terms of lived experience. And that could be true for anything in relation to children and families, literally anything. So that is in that context, it was severe absence, but actually in terms of severe absence, many of which would be vulnerable to CCE. 9 times out of 10, those issues are nothing to do with school. And actually it's the interagency context that's important. And on 100% of occasions, it's about the relationship with a trusted adult that will actually enable that child, young person, family to re-engage, whether that's a youth worker, social worker, I don't know, police officer, somebody next door. It doesn't matter, but ultimately it's that trusted relationship that's going to enable that, not a prescription of what a particular service should look like. And also it needs to be, voice and influence needs to be real. It can't be an add-on, and it needs to be from the outset and consistent, and it needs to do what it says, voice and influence. The influence bit is the important bit. Yeah, lots of ways.
Thank you, Steve. No, that's helpful though. And I think, yeah, I like that point you made at the end about voice and influence, because I think sometimes that's what we don't always get right, is that there's very good intentions of co-designing and talking with young people, but it doesn't necessarily follow through in the reality. Yeah, Helen, I can see you've got your hand up.
Yeah, so I mean, the way that we've done it is, as I mentioned, that we have trained a team of young people who we put through a youth empowerment program, and we pay them for their time. So that's obviously one way to make sure that they turn up and they come along, and then they find out they actually quite enjoy it. So they are a group of young people who are trained both to do research, but also they are trained in public speaking, so they can help us with advocacy. They can help me with fundraising when I go and see businesses. They can be involved in consultations. So if a commissioner wants to commission a new service, they themselves they feel at ease being in those situations, because I think the assumption that you can just ask young people what they think, actually it's quite hard work to run a really good consultation. So I would say make sure that you allow plenty of time. And I think if you can have young people involved right from the very beginning, so to help you design those questions, ask the questions, because peers love talking to their peers, and you get different responses. You need to ask professionals as well, but and then involve them all the way through. So we also have our young people, our youth associates, as they go on to become. We pay them to quality assure services. So they will go out and check that what they thought was going to happen actually happened, and they'll feed back, not in a negative way, but they'll feed back with suggestions as to what they think would work well and what wouldn't work well. And actually they've got a bit of momentum, the young ambassadors who have now become youth associates. So as they've got older, when they come back from some of them are at uni, when they come back, they are able to pick up, paid work, looking at services, join consultations with businesses, and help train a new group of young people coming through that. So yeah, I would just really encourage people to look at who might be doing that piece of work already in the voluntary sector, because there are experts probably already doing it, and it is probably a lot cheaper to use people who do that as part of what they do every day than to go away and start a new piece of work. And actually, Westminster City Council often work with us in shaping services, because they know we are able to access the voices of young people quite effectively.
Thank you, Helen. And I think, yeah, that's one of the key things for any project like this, is reflecting on where do the strengths lie in the local authority, where are those strengths in the voluntary sector, and how can you kind of collaborate and work together, because there'll be some communities that you, as you say, can tap into, or voices that you can tap into that might not trust or have that relationship with, local government, for example. So yeah, it's about coming together. Yeah, Steve, Bywater.
I think you just said what I was going to say, really. It is about
Sorry, Steve.
trying to hear a range of different voices. So yeah, you could do a fantastic consultation event at a youth hub and get a particular group of young people who are already engaged with that coming along. But it's listening to people who aren't going to activities at the moment, aren't engaged, thinking about what schools are picking up. All of our schools have just recently gone through a process where they've surveyed young people, which sounds quite straightforward, but it's amazing the volume of different voices that have contributed to that. And yeah, partners who are engaging with very sort of particular communities that we might not hear at all in the traditional sort of settings that we provide. And then importantly, opportunity for young people to look at kind of the data that comes out of that, and see whether it tallies with what their understanding is of the communities they live in. And it might challenge some preconceptions they've got, or it might also help us to actually understand a message which isn't really coming through. And finally, I think Steve said this, but also thinking about parents and their wider families as well. Important, obviously, young people are the key point for whom we need to get sort of feedback and ideas from, but the parents that support them in most cases are still there, and they might have views that are really important if we're going to have young people coming to kind of services that we think might be good for them. So yeah, just getting that range, I think, rather than just going to one place.
Yeah, thank you, Stephen. Definitely, totally agree. You don't kind of want that confirmation bias of knowing that you can get a group that you're already engaging with coming forward to, I suppose, just sign off what is convenient. You want that kind of challenge as well. We started to touch on some of this, but it'd be interesting to talk a bit about the design and implementation, and the views of you guys as panelists of what you think the key things are that should be considered during design and implementation of the Young Futures hubs. And I think a couple of things we've possibly already touched on. I think one, that they need to be local and they need to reflect local communities, and I suppose two, that this isn't a totally new concept, and actually I suppose the design and implementation, it's okay if it does build on in some places what is already there, and what we already know works. But yeah, I wonder if Charlotte, I might come to you first, just because I know as part of that blueprint that you talked about at the beginning, implementation was a key part of that. So I wonder whether you have any thoughts on the design and implementation approach for Young Futures hubs.
I've just seen a couple of questions in the chat as around the Young Futures Hubs policy, which I can quickly respond to as well, if helpful. So there was a question about the 8 areas for the first set of hubs, and we don't know yet what those areas are going to be. We just know that they're going to be areas where there's high levels of knife crime and antisocial behaviour. So the government is still yet to announce those. So in terms of the implementation and like what needs to be considered in the design and delivery, I think that is really for local areas to decide. And I think what's really important is that the funding kind of channels through to those local areas, and then local areas kind of map their existing youth provision, what's already happening, and then they bring those people together to kind of think about, okay, what does this hub need to look like? At the moment, we are thinking that they're going to be local authority commissioned. That's us guessing. We haven't had that fully confirmed yet. But yeah, I think it's really crucial about thinking, okay, who can we funnel the funding through to? Who gets it? What is it multi-year? What agencies need to be involved? How can we bring capacity to local areas to have those conversations and bring those services together? And I think it's kind of in my head, it would be national providing the resources and then those decisions being made locally. Because I think, as Steve said, what could work in Birmingham isn't going to work in Rochdale. So it's really important that they're locally designed and led. And I would just re-emphasize again, like mental health kind of being that centre point in which the hub is then based around, and support is kind of, put around.
Thank you, Charlotte. That's really helpful. And I suppose, what will work, I think Steve said this, in one part of Birmingham also won't work in another. So it's being as hyper-local, I suppose, as possible. And as you say, local areas having the freedom to do that with the support from central government, rather than it being too prescriptive. I don't know if anyone else had any reflections on that kind of design and implementation point. I mean, we obviously spoke about the involvement of young people as well, and that will be critical, I think. Helen.
Yeah, I think a couple of things I'd say is where they're based is really, really important. So if young people don't normally want to travel very far, so the obvious thing might be, say, in Westminster, to put it in the middle of the borough if you were going to have one, but you can be sure that the people in the north won't go there, and nor would the people in the south. So you'd actually end up with hardly anyone using it. I think making sure that the building itself, we did talk about maybe using the family hubs as places to deliver youth services, but the feedback from young people is they look like places that babies would go to. And so they felt very strongly that it needed to be aesthetically a space that they liked and felt comfortable in, even to the extent that 8 to 13-year-olds, what they want the space to look like is quite different to 13 to 18-year-olds. So I think kind of really thinking through where they are, what they might look like, and also who's working out of them. So it doesn't have to be statutory provision. The voluntary sector often has the trusted relationships in place with those communities. And where you've got a supplementary school delivering to a particular cultural Albanian group in Westminster, and you want to reach Albanian young people, then actually thinking about who's in that space at a certain time not only can sometimes cut down on the cost, but it makes sure that you've got the right people delivering the right services to the people who really need it. So I think just really thinking it through and asking young people what they think, rather than making decisions, as everyone else has said.
Thank you, Helen. I think, that geography point is a really interesting one to think about. And as professionals, we can often come with a view on what makes sense. And actually, I think it's to some of the points that people have made around the table around those services being open and available to young people, but us not making assumptions about how they should be available based on our viewpoints. So that's really helpful. Steve K, did you want to come in quickly on that one?
I did, yeah. So, well, first of all, I'd say it's not, for me, it's not about either or with the voluntary and community sector or local government, because actually we're all public servants and we're all in the same space. For Westminster, that might be a really good model. For somewhere else, it might not. It really does depend on the context of the individual area, and I don't think one is more equipped than the other. We need to be working together, and that goes back to my kind of collaborative advantage point. But what I was going to say was, every area, every local authority will have data coming out of its ears in terms of what goes on in terms of a local context. It might not be used in the most effective and efficient way, but that information and that intelligence will be there. From a social work perspective, from an early help perspective, from what's going on with family hubs, from local policing, local voluntary groups, really importantly, children and families themselves in communities, and all of that needs pulling together to understand the context of a particular locality or a district. And then it needs to be decided on who's best placed within that context, and that may well be voluntary and community sector. It might be, if you have a trust, it might be them. It might be the local authority themselves in terms of delivering that provision. But it needs to start an end with the needs of children and young people. And you can't retrofit services around that. It needs to be, what are the needs of children and young people? What do we understand about those needs? And what can we do to design with them the most effective intervention in relation to meeting those needs? And if you start and end with that, you're not going to go far off track in terms of the resources that you've got. If you don't, and it becomes about politics with a small p or a kind of competition, then you've already lost. At the beginning, it needs to be about those needs of children and young people.
Yeah, totally. Thank you, Steve. I'm just going to come to one of the questions also in the chat for panelists. So what are your panelists' thoughts on the age range for services? Steve Bywater mentioned transition to adulthood and provision up to 19. Should services for young adults, e.g. up to 25, be included or separate in your view? I suppose some of this might be answered by some of what Charlotte said, and Charlotte's just about to come in, so I won't speak for you. Go on, Charlotte.
Sorry, I just raised my hand because we feel as Funding Hubs quite strongly on the age range for these services. So we know that they're going to go up to age 21, which is in line with the National Youth Strategy, which is about to be published in this new youth guarantee. We feel quite strongly that services need to go up to age 25, and many kind of early support hubs that already exist are kind of that up to 25 age range. Young people kind of need to have that support up until the age 25. Particularly, we know that mental health needs are higher in younger adults, that there's a lot of service kind of drop off in terms of transitions between services. So we're really pushing that this Young Futures Hub model needs to be age 25, and kind of not off at a cliff edge at any younger. Sorry, I jumped in really quickly there, but just because it's something we feel quite strongly about, that up to age 25 it is the way to go.
Not at all, not at all. And the point I suppose I was going to make is that to all the points that the panelists have made around designing it around young people's needs, is that that provision can be there up to 25, and it may be that in one place it looks a certain way, is marketed a certain way, is spoken about in a certain way that may be different in another community. But as you say, Charlotte, it's about having that provision available to support young people. I don't know, Steve, Bywater, if you wanted to come in at all on that question, just given it's off the back of what you were talking about.
Yeah, I think it goes back to flexibility, really, about what we're able to do with the funding in terms of setting up the hubs, and what do children and young people actually need, and what would they be comfortable about accessing. Helen mentioned the thing about young people not really wanting to go to family hubs because it felt like it was places for people to take their babies and so on. It's then whether we have somewhere that focuses on someone who's just left secondary school, which who has different pressures maybe when they left primary school and are moving towards adolescence, with people in their early 20s in the same space. It would be, we'd need to think about what those different cohorts would be comfortable with, what the design of the, if it is a place as well, where they go, and whether that would sort of meet their particular needs. The other thing I'm thinking as well is, I think we're starting to sort of think about a place for people to go, and whether that needs to be all of it, whether it's more maybe about thinking what do children and young people and young adults need, what do we have, and what's a good way of coordinating that and making it available to people when they need it, rather than focusing on, you know, who needs to access what building and when's the sort of earliest and oldest age that they can access and not access it. Also conscious as well, and Helen might want to say more about this, that the members of the Young Westminster Foundation, the organisations there, work right across that age range into the 20s as well. And that, I suppose that's a model, isn't it? Sort of thinking how those different services work together and collaborate.
Thank you, Steve. That's really helpful. Okay, I'm going to move on to our next question, just conscious we've only got about half an hour left. So what do you think the potential challenges young futures could face, and what do you think some of the opportunities they offer for young people? Quite a broad question, but I'd be interested to hear your thoughts. Yeah, Steve K.
I think obviously we don't know what it looks like yet, but there could be some challenges with stigmatization if they're not pitched in the right way to young people. So young people might not want to go, particularly because of the focus around what it is. It could be about geography, because even, you know, I think it was Helen who said about young people might not want to travel from one part of the borough to another, and that might be a thing, particularly given the context. Some of it might be about, you know, the accessibility and anxiety of young people accessing a hub. Another might be about, what does a hub actually mean? Is it a hub network within a particular district, which I think would be more sensible? Is there an online version of what that might actually look like with perhaps a mobile physical presence? Is the hub mobile, which I think would be a really interesting concept. I've certainly in the past worked really successfully with exactly this client group with mobile facilities, which I think is an interesting concept, and actually the recognition of how the professions actually collaborate and work together, and what that means, and then how it's resourced is I promise myself I won't go on about it, but how it's resourced is really important, and what that actually looks like, and then also how that is supported and locks into the wider well-being system within it, whichever area it actually is, because they can't sit in glorious isolation. They've got to connect coherently with the Early Help Strategic Board, or whatever version of it is within that particular context, and also kind of safeguarding board, and what actually happens. There needs to be visibility and connection with them, but they're littered with challenges, but also opportunities, I think. So it's there's a lot to navigate to establish them, but also I think, as we've all said, these are not new ideas, and so it's about how we utilize the resources and the mechanisms that we've got in order to be able to deliver them effectively.
Thank you, Steve. Helen, I'll come to you next.
Yeah, I think Steve Kay's right when he says that they're not new ideas, and in fact we were forced to rethink how we were going to do things in Westminster when all the statutory funding was taken away from youth services about 10 years ago, and some of that has now come back in, but it did make us completely rethink how the hubs might work, what statutory services could deliver from those spaces, and how the voluntary sector could also support the statutory sector to deliver a service that, as Steve mentioned, children and young people would want and would benefit from. And I think that it made the council think much more about how the voluntary sector were able to offer things that they maybe hadn't thought about before. And I think that there's a huge shift in the quality of how the voluntary sector are viewed in Westminster, to the point that I co-chair the Early Help Board, which has resulted in youth workers being part of the integrated leadership team in the family hubs. And so there is a real opportunity, I think, for people to think about how we approach some of the issues, and how to do it in a way, you know, I think this keeps coming up again and again, that just saying it's around youth justice, serious youth violence, and severe mental health issues is a pretty sure way to make sure that young people have a view about why they won't go there, as opposed to designing them in a way that they're places that young people really want to go to, and the trusted relationships that are there are the way of delivering the services that the government are talking about.
Thank you, Helen. Steve Bywater.
Just another challenge is thinking about how we prove that it's making a difference, and how we evaluate a new intervention. I think most of us probably on this call have struggled over time to sort of show, even though we passionately believe it, that early help and early intervention has an impact. So here's another way of working, I suppose. And yeah, how will successful areas who have hubs be expected to report on what they've been doing without getting into the usual sort of just numbers that are accessing a service type measure. We've been doing some work across London trying to develop a family hubs outcomes framework, and we've expanded that and thought particularly about young people and parents as well as part of that, and really forcing ourselves to think about outcomes and how we're going to measure that. And then also importantly, how we can drill down to localities as well. So that sort of work be great if it could be allied into another development, but just acknowledging that it's difficult, but it would be good to do it in a way which does show outcomes rather than just metrics and numbers.
Thank you, Steve. Yeah, definitely. And I think particularly I think the what you measure matters, because also it can actually impact whether you're delivering that change for young people as the kind of end user, because often, as you say, you can measure how many people are accessing a service or turning up on a given day, but just because someone is turning up doesn't mean that they're getting the support that they need. So I think it's about measuring intelligently from the outset, so that you don't kind of end up in a bit of a KPI rabbit hole, which often we can with public services. Yeah, Charlotte.
But it's just to provide the kind of national perspective in terms of what the challenges are. Agree completely with the stigmatization point. I think firstly, as we keep coming back to, is the funding. So the government manifesto committed 95 million to Young Futures hubs. The announcement last week, we have seen 2 million for 8 hubs. So effectively that's going to mean 250k per hub to be set up. If that's the kind of basis we're working on for rollout of the next 50, that is well below the 95 million that has been pledged. So where is that money? Well, what are we going to see that full investment? I mean, I would still argue that 95 million isn't enough if we want a comprehensive network. So I think that's one challenge. And then I think secondly, it's that cross-government approach. So Young Futures hubs started life in the Home Office. They were very much a Home Office policy. They are now with the Department for Education. We don't know if that's going to remain the case, but at the moment DfE are delivering them. It's really important that Department for Health and Social Care have a stake in these. You know, Young Futures hubs were a massive part of the 10-year health plan that came out a couple of weeks ago. They're kind of the cornerstone for the children and young people's mental health policy commitments in that plan. And I think we're concerned that at the moment we're not seeing that cross-government approach kind of play out. And actually, if that's not happening at a national level, how is then that going to translate locally? And these hubs are really multi-agency, multidisciplinary in their very nature, and we need that replicated kind of at all levels.
Thank you, Charlotte. And that tees up actually nicely the next question I was going to ask, which is exactly to the point you just made around how can and should these Young Futures hubs work within the wider system of support services that we know are in place. So I think, Charlotte, your point just then kind of alluded to some of that, which is the challenges at a national context. But obviously, we know for these to be a success and to deliver kind of multi-agency support, they're going to need to fit and work within a wider system. And actually, that might look different depending on whether you're in Westminster or in Birmingham or wherever it is. So what are some of the things you think people should think about when they're looking at, I suppose, support for young people, provision, future Young Futures hubs, and how they can fit them into the kind of wider system of support in their area? Yes, Steve K.
I think it's about understanding the environment and about what currently exists. So, you know, we've not talked about schools sufficiently yet, but actually schools have had to shoulder a lot of the burden from some of the reduction of public services, and as a result, they've struggled. Some young people have struggled, and you know, and mostly they've done a great job with not a lot. But in terms of young people's mental health, it's complex, and it doesn't necessarily neatly fit into a single service or a single approach. I think Helen's point, or was it Steve? I can't remember. In terms of that was actually Charlotte. The interconnectedness of the government departments, it's crucial because, you know, DCMS have a role, DfE have a role, Home Office have a role. But I think part of the problem, and colleagues in civil service work really, really hard on these programmes, but even within the DfE, what part of the challenge that we've got is it can't be seen as a discrete project that only some individuals have to connect with, and so the local government or will have a conversation with that particular team on these things, when actually there's a plethora of other programmes which is highly relevant and that it connects to, whether that's related to family hubs and social care or whatever, because young people don't neatly sit into a departmental or service-centric approach. And so if we've got to deliver holistically and think about the needs of children and young people holistically, and we've got to kind of connect in terms of a collaborative advantage at that local level, it's just so crucial that that happens at a departmental level. Otherwise, it won't work as well as anywhere near as well as it could.
Yeah, definitely. That's really useful. Thank you, Stephen. I think we've probably all got reflections on the call of when that can create challenges when you're then delivering at a local level, confusion about the flexibility you don't have that sort of thing. So it'll be really critical, particularly if we're saying that I suppose that power to design this around young people needs to sit at that local level as well. Helen.
Yeah, I was just going to say that, I mean, because we tend not to, we have a couple of small delivery projects, the training of the young people being one. So, I mean, the mapping of local services, I think is really key. And by that, I don't mean like you have to spend, I mean, a giant sheet of paper actually works pretty well with voluntary sector in the room and early help, and actually working out exactly what you already have and where the gaps are, and matching that up with what young people have told you, at the same time as enlisting the support of your local councillors, your local MPs, bringing them out to see things. And I must say that I know that doesn't fix everything, but actually trying to get everyone, including politicians, locally on the same page means that at least you then know where the gaps are in the services. So yeah, I mean, mapping really, it seems quite obvious to me, but councils are often so big and so clunky that they don't even know what is being delivered in different parts of the council. So you'd have children's commissioning, but then you find out that the regen team are delivering something for children and young people or want a consultation. And I think that, and that's not criticism, it's just that happens differently in a very large organization. But there's kind of ways of bringing people together to at least do that. And that has been very effective, I think, in Westminster.
Thank you, Helen. And yeah, definitely often, yeah, people engaging with similar organisations in different ways and often quite reliant on relationships internally for people to know who speaks to who, etc. So that's really helpful. Yeah, Charlotte.
I think there's some really great examples of hubs that have been around for years that are really embedded within their local systems. So, for example, there's a service in Liverpool called the Young Persons Advisory Service. It is a hub kind of model that's been going for 50 years, and they're really embedded as part of the CAMS pathway within the local area. They work with CAMS, they work with schools, and as part of that, they're part of that pathway of support. Equally, there's a service in Peckham in South London called the Nest. They go in and work with schools. They also have that kind of drop-in space, work really closely with mental health support teams, but also, again, a part of that CAMS pathway within the local area. So I think it's about when it's coming back to that design and implementation question, but how can we make sure these hubs are kind of embedded within local pathways and systems of support? You know, some hub providers might also provide their mental health support team. They might already have those relationships with CAMS clinicians. How can these services support those young people on CAMS waiting lists? So again, there's really great examples of that happening. And I think it's just really useful. Kind of, we've got family hubs for early years, and we've got like MHSTs and all stuff happening in schools. Then we'll have hubs in the local community, and then we have CAMs for those that kind of need that more specialist support. So they really are kind of part of that whole pathway approach to supporting young people.
Thank you, Charlotte. That's really helpful. And definitely, I suppose one of the key things also, something for central government to think about, but will be interesting as these potential Young Futures hubs develop, is how can that learning be shared across the system? Because there will be people who feel this is their bread and butter and they've been doing it for a long time and they've built those really strong relationships with communities, and there'll be other areas where at a local level it feels quite daunting and is maybe something that, you know, doesn't feel as established, and it's about how do we share those lessons and learn from one another rather than everybody starting frantically at the same time. And some of that's done through, you know, organisations like yourself, Charlotte, doing that advocacy piece. You know, some of that will be done through voluntary organisations, but also we know across local government there's always opportunities to learn from one another. I'm just going to come to one question in the chat that I thought was quite interesting to pick up. And someone was asking if there's an opportunity to utilise technology as a way to engage young people, rather than just thinking about this in terms of kind of physical hubs. And I think an example they gave was AI, which is kind of the topic of the moment. But yeah, I suppose an open question to you all about what you think the role of technology could be in providing that support to young people. And I suppose what the risks might be, I guess, as well. Yeah, Steve, Kay.
I think it would be foolish not to explore a digital option as part of this. I think young people, well, we all communicate extensively, don't we, digitally. I think I don't think it's an either or. I think, you know, there needs to be, you know, there are versions of, you know, a local youth offer or kind of all of those things, but how accessible is that to young people? That I suppose that's what, you know, we could spend an inordinate amount of time developing a you know, the local youth offer, and actually young people don't even know it's there or access it, or, you know, those kind of things. But I do think a digital option, Steve has already mentioned COOF, which, you know, as young people can access in terms of mental health, and there's all sorts of versions of that or opportunities like that. So I think some kind of virtual hub or mobile hub or both, in addition to a physical building, is important. But for me, I'll go back to what I was saying earlier. It's about the network of support within a district and a community and what that looks like. And I think there does need to be that emphasis on that collaborative advantage cross-sector within that district, and also the national focus in terms of youth and community work and also careers guidance as part of this. I appreciate that that's not the only show in town in relation to these things, but certainly a digital offer needs exploration. Certainly the use of AI is sensible. It's growing at a rate of knots. Would be foolish not to use it. Otherwise, it's adults who are not necessarily equipped trying to communicate with young people who are communicating in a number of different ways. So it needs to start with the needs and aspirations of young people, and also part of that needs to include how do you access these provision, how do you access support, what does that look like, and we start from there and then build back.
Thank you, Steve. That's really helpful. I'm going to ask one final question, conscious of time, and then I will wrap things up. This has been a really interesting discussion. And we alluded to this slightly earlier, in particular, Steve, Bywater brought this up. But I suppose a key part of this will be being able to evidence the impact that the provision and the support to young people is having, that continued investment makes sense. And obviously that will be particularly important given the financial climate across local areas. We know that it's a challenging picture. So I suppose an open question to our panelists about how can people beginning to develop Young Futures hubs think effectively about measuring impact? You know, what are some of the things that they should be thinking about? I mean, Steve, you spoke earlier about not just thinking about KPIs, but thinking about outcomes. But I don't know if anyone had any reflections to share on how you can think about measurement well and not fall down kind of common pitfalls when developing hubs, these kind of early interventions, methods of support. Yeah, Helen.
Yeah, I was just going to say that we've worked quite hard in Westminster to try and develop a kind of framework that works for the voluntary sector and for the council. And that, I guess, has meant a bit of compromise on both sides, because I guess historically the voluntary sector haven't always collected data to the same level as the councils, but they increasingly know that they have to do that. So where they're commissioned, there's an SLA in place telling them what they need to report on. We have supported them with kind of our capacity building arm in how to do that, to develop good practice around collecting, but it means that we have much more data, because not only does Steve have, and Steve kind of leads on this work at the council, not only does Steve have the data from early help, but we're also able to supplement that with much more data from quite small organizations. And so Steve can talk a bit more about the common frameworks we've been developing, and actually that has been quite challenging, but I do think that it will probably result in better outcomes generally, but better information to base decisions on.
Thank you, Helen. And yeah, totally. I think it's having the information to also be confident to say this doesn't quite work, and we need to go back to the drawing board and kind of look at how we deliver something, or is this the right support that we're offering? And I suppose without that information, often it can be a case of kind of cracking on with what we're doing, even if it's not necessarily the right approach. Steve Bywater.
First person to come on mute the whole session. Sorry about that. The way I'd like it to go is the areas that get the funding to be told why they're being given the funding, what the government intentions were for that. And then it's kind of up to the local areas to decide how they're going to measure that themselves. So what are the outcomes we're going to be seeking locally? What data will we need to show that? And an important part of that will be the discussion with young people who are hopefully going to use those services, or young people in local communities, what they would like to be seeing different, because interventions are different, I suppose. And then I suppose it's that sort of leap of faith to let local areas come up with their own frameworks. As Helen said, we're trying to put more localized data together and sort of dig beneath the surface. If you look at any London borough, various rates of something you might be concerned about disguises a huge range of differences from area to area in a tiny borough like Westminster, and that'll be the same everywhere else. So I'd just like the opportunity to be more sophisticated about this, I think, and measure something that we know locally is something that's important, everyone can sign up to. That's my dream, I suppose.
And hopefully it won't be a dream in the end, but I know in some of the other work we've been doing, particularly around kind of place within mutual ventures, measurement has been something that's come up time and time again, because the traditional ways we measure kind of interventions and how we work with people is that who turns up at the door, and that doesn't actually necessarily mean we're having an impact when you look into the data and it's the same people turning up at multiple different doors in multiple different places in the community. So I think if you can think about it at the beginning and almost challenge everybody around the table to think about it in a different way, it can also have a real impact. Steve Kay.
I was heartened recently. I saw a government document out for consultation around an outcomes framework, but utilising outcome-based accountability, which is not a new model. You know, it's been around maybe 20 years, but it's the best thing I've come across, because it's just dead simple. It's quantity, quality, impact. How much have you done? How well have you done it? Is anybody actually better off? And I think if that model is used across these hubs, thinking about, which allows for local context, it allows for history, it allows for all of the complexities that exist within a local area, but it kind of starts with, it's about the creation of outcome-focused alliances to deliver outcomes rather than service-centric or organisationally focused solutions. And for me, that's absolutely crucial. So whichever framework that we develop, or outcomes framework, etc., and I've been involved in lots, those basic principles of quantity, quality, impact, how much have you done, how well have you done it, is anybody actually better off as a result of this investment and all of the work that we're doing? You're not going to go far wrong.
Thank you, Stephen. Yeah, totally. As you said, that kind of people focus rather than service or organisation centric, I think is absolutely key. Conscious of time, this has been a brilliant discussion and I could keep on asking questions, but people might not forgive me for keeping them any longer. So I'm going to wrap up our discussion today. A huge thank you to our 4 panelists who've been wonderful. I suppose just a reflection from me and some of the things that we've talked about. I think at the top, the most important thing is that engagement with young people, that meaningful engagement that delivers genuine impact, rather than just kind of engagement for engagement's sake. And then I think also the other thing we've touched on, and I think has come up time and time again in this discussion, is the need to be hyper-local and to empower local areas to design solutions that meet the needs of their young people, rather than assuming that we know what the needs might be. Making sure we don't lose that focus on mental health, and making sure that actually at a central level government is working together across departments that need to be involved, because that will help us all to work together across local government, the voluntary sector, police, NHS, etc. at a local level, if we've also got that at a national level. And then I think I'll finish on this, which I quite like Steve saying, but thinking about that quantity, quality and impact, and thinking about that when we're looking at what we measure and how we deliver the support for young people. So thank you again to our panelists. It's been a really interesting discussion, and thank you to everybody that's joined and asked questions today. We'll follow up with you all afterwards, so you've got the recording and also the slides that were shared as well today. Bro, thank you all.
Thanks, guys.
Thank you.